Hello, hello, and welcome. Listen, today we're going to talk about one of my most frequently asked questions. As a physician, one of the questions that I get asked the most is, when can I come off of this medicine? A lot of people want to know, do I even have to start this medicine? So, my question for you today is, are you on a medication? Do you want to come off of that medication? Are you wondering, do I have to take this forever? All of those things. If that is what you are concerned about, you are thinking about, then you are in the right place because you are not alone. And like I said, I get this question quite frequently. So today, we are going to talk about it. We are going to talk about when you can get off the medicine, how you can get off of it, and do it safely. So if this is something that interests you, you want to make sure that you continue to watch. If you are new here, hello and welcome. I am Dr. Ashley Booth. I am a board certified family medicine physician, and I provide practical health tips and tools that you can use in your everyday life because what I understand is that your life affects your health. Now, before we get into it, just the simple little things that we have to talk about, which is just subscribe to the channel, especially if you're new and you haven't done it. If you've been with me for a while and you're like, I don't know, go ahead and do it because, again, all the information is free. I'm not going to spam you. You also want to make sure that you get this out to other people so that they will know and just want to go ahead and just share it with them because we want to make sure that everyone is well informed because this is your body and you want to make sure that you do the right thing for your body. So now let's just jump into it, okay? When can I get off of medication? That is the big thing. But before we even talk about when you can get off of it, we have to talk about why you are on that medicine in the first place. And one of the reasons why you are probably on it is because something is not well controlled. That's typically the reason. If it is blood pressure, like high blood pressure, if it is diabetes, thyroid, whatever it is, something is not well controlled. It can even be something like inflammation in your body, arthritis, all of those types of things. Something is not the way that it needs to be, and it is causing an issue for you, some discomfort, or it is causing this disease state in your body. Either way, it is not well controlled, and you're going to need something to get it back under that control. That something is usually medication. Now, sometimes there's some other things that we can put into place, but it depends on just how severe it is. Do you have to be on medicine in the first place? For instance, blood pressure. If you come into my office and your blood pressure is 200 over 100, that tells me that you are at a significant risk of having a stroke. You could feel perfectly fine, but then leave my office and have a stroke in the parking lot. And I tell people that all the time, right? Stroke is a silent killer. So if your blood pressure is that high, we have to do medication, and that is to protect you and to keep you safe. Then, if you come in, the guidelines, most of the guidelines are coming back to that 120 over 80. And if you are in that one, and so if you're just kind of like that's where you want to be with your blood pressure. So if you are like 130s over 85, then that's when we could potentially talk about some lifestyle changes, how you're really going to be able to incorporate those to get things down. So, again, it depends on how severely out of control you are. And that will help us to determine, okay, what do we need to get it under control? Again, at the end of the day, the medication, and this is what I tell everyone, the medication, its job is to protect you and to keep you safe. Because when that disease process gets out of control, what it can do is cause a lot of damage to the body. And we don't want that. But once we start getting those things under control, then we can start talking about some of these other things, like how can we get off of it? But one of the things I want to touch on before we even get there is there are some misconceptions about medication because one of the reasons why a lot of people want to get off of it is because there is this harm that you think is going to cause you. One of those things that I get, like for instance, people say metformin. I get this all the time. Metformin is going to mess up your kidneys. And I said, no, that is not accurate information. The thing is, if you are on that medication and your kidneys aren't functioning that great, then we need to consider something else because it can cause an issue later. So we have to be more well informed about what that medicine can truly do to you. We have to talk about benefit versus risk. Like I said, your blood pressure, if it is 200s over 100, you are at a significant risk of having a stroke. You are like living on grace to still be walking around with the 200s over 100s and not have any issues. The thing is, talking about medication and putting the medication in place, what it is going to do is try to keep you safe and keep you from having a stroke. So, do we want to take medication to keep it under control, or do we want to have the risk of the stroke? Now, medicines have side effects. I am not going to say, oh, medicines are all great and there's no issues. They can have some side effects, but again, we have to talk about the risk versus the benefits. So, do I want to take it to prevent from having a stroke because I'm at super, super duper high risk, or do I want to risk having a stroke? Right? So, we have to think about that when we think about taking the medication in the first place. So, now I know you like, okay, get to the point, right? When can I get off of this medicine, right? So, because one of the things is people are like, do I have to take it forever? Not necessarily. It depends on where you are on the spectrum. It depends on what it is controlling. There are a lot of different factors in there. But when you think about coming off of the medicine, you have to, this is one of the things I want you to make sure that you consider. You want to consider that your numbers are controlled or better than controlled so that when you come off of it, things will be where they need to be. Now, this is what I mean. You have a goal. The reason why you're on that medicine is because you are beyond where you're supposed to be. We all have these normal numbers that we say, if you stay in this range, you are safe. If you get outside of this range, we're going to start to see some issues and some problems, right? So we get you on medicine to get you back in that normal range. If you are on medication and you are safely in that normal range, that is not the time to come off of the medication. That is not the time to consider it because that tells me that the medicine is doing its job. Because as soon as you come off of it, those numbers are going to start to go up. And this is what I see. I have some people that say, I came to you, we did my labs, and my labs were normal. So now I want to come off the medicine. I'll say, please don't do that because this is keeping it under control. They decide to do it anyway. And then I recheck the labs and we see that those numbers are now higher than normal. And I say, what happened? They said, oh, I stopped taking the medicine. I said, well, didn't we talk about not doing that? And they're like, yeah, but I just wanted to see. But that's what I tell them all the time. The medication is to keep you in your normal range. If you are in that normal range, then the medicine is doing its job. Now, we have normal here. If you go outside and you go to the lower side of normal, then that's when you can start considering coming off of the medication. So if you are less than normal, then that's when we can start considering because we're like the medicine is doing its job and is doing better than what it's supposed to. And that's where you can start having side effects from that too, because we don't want you too low. And that's when you can start considering coming off. So if you are in normal, no, medicine is doing its job. If you are below normal, then that's when we can start considering when you can come off. Now, how do you do that? Before we go anywhere, hear me and hear me good. You have to do it under the supervision of your doctor or whoever your medical provider is. You should talk to them about it. Don't say, oh, I'm just going to do this myself and I'll take myself off of it. No, because when it comes to medications, you have to what we call titrate down. So that means we have to come down at a certain rate. So if you're taking a certain dose, then we may have to cut that dose down a little bit or decrease it. So titrating down, decreasing it down, depending on the type of medicine you're on, can determine how long it may take for you to come down off of that medication. Depending on how high of a dose that you're on, may determine how long you can come down because you may not be able to completely come off like that. What we have to do is say, okay, you've done some things. We're going to come down a little bit. You're now in normal on this dose. Then you do some other things, then we come down. But it is one of those things that we have to continually do over time. So you actually need to make sure you do this with your doctor or whoever you're under the care of. You want to monitor your numbers if you can. So if you have high blood pressure, checking your blood pressure at the house and checking it twice a day. I have a great TikTok. You want to follow me on TikTok, Dr. Ashley A. Booth, MD. I am on there. I put up a great video of the do's and don'ts of checking your blood pressure. It shows you how to do it, what to do, all of those things. You want to do that because then that'll show you how you should check it. That's blood pressure. But any of these other things, because there's some things that you can monitor at home. For instance, when it comes to blood pressure, some people's blood pressure can be high in my office, but they say, Doc, when I'm at home, it looks like this. Well, then I want to see where you are in your normal environment. So if it is consistently low, then that's when I need to start considering like making some adjustments. So there are some things that you can do and monitor yourself at home. Other thing, keep your appointments with your primary care doctor, because, or whoever is monitoring the things. You may have a specialist that's monitoring some other things, whatever, but you want to keep your appointments with them because they need to check and do some blood work and make sure that you are okay. One, we have to make sure that the medicine is not causing you any issues. And two, we need to make sure that the medicine is doing its job. So you have to follow up, and following up and say, oh, I'll just go like a year and a half or whatever. If you are on a medication that you have to take consistently every day, you need to see your doctor at least once. And I would strongly advise twice a year, because they need to monitor and make sure that everything is okay. So when you go to the doctor, they can see, are you normal? Are you abnormal? What do we need to do? Do we need to go up, go down? So they don't know how to safely take care of it. The other thing, work on controlling the things that you can. The things that you can do, that's lifestyle. That is what you eat, your diet. It is how active you are. Are you getting out and are you exercising? When you do those two things, the weight loss is going to come. A lot of people, right now concerned about weight loss, but you have to put those other pieces in place. You have to start doing your due diligence with your diet. That's what you can control. You start exercising, then a lot of that is going to lead to the third thing, which is weight loss. A lot of times when you start putting those things in place, we start to see how some of these other things can get under control. And that is a natural way, because I have a lot of people say, how can I naturally get this down? That is something that you can do. You can naturally get it down by controlling the things that you eat and the things that you do. And that can help get your whatever that is that's out of control under control. I want to preface this by saying that genetics is one of those things that's just kind of out here that can affect you, and you can do all the things, because I tell people this all the time, because it's like, I've done the things, I've exercised, I diet, I do all the things, and this still is not well controlled. Then that's when I say there may be a genetic component that is not working for you and could be working against you, unfortunately. And we can still see the numbers get high, blood pressure can still go up, diabetes numbers can still go up, but you still want to do what you can do to make sure that you maximize that on your end. So then that way you still don't have to take as much medicine, and that you can still be okay. So know that sometimes you can do all the things that you can do in your power, but the genetic side of things can still throw you off. That's just one, but it doesn't happen that often. I've only come across that a couple of times, and it has gotten frustrating for a couple of people. So I had to preface that, let people know. But no, I still tell those same people, you still want to maximize and make sure that your body is in the best shape and the best temple that you can have, so that you are able to do what you can for it. Now, the other thing that I want to make sure that you truly, truly get from this, because in order for all of this to work, is that you must be getting to the root of the problem. Like, what is causing the diabetes in the first place? What is causing the high blood pressure in the first place? There could be, like I said, a genetic component. It could be what you're eating. It could be what you're doing. It could be a multitude of things. And you have to get to the root of that. Well, how do you do that? You need to partner with an expert, and that expert is your primary care physician. I know a lot of times we see specialists and all these people, and that's great. And if it is specific for that thing that you're dealing with, you definitely want to make sure that you partner with them. But also, partnering with your primary care physician is also key, because they are kind of like the gatekeepers. They're the ones who are going to watch and look at all the things and make sure how everything is going, right? And they can look at all the different moving parts in the pictures, and see the big picture and see where you need to go, what you need to do, and make sure everything is in order. But you want to make sure that you develop that partnership with them. And that is going to take some time, some trust, and building a relationship that you want to have with any medical professional who is dealing with whatever that you have. Because at the end of the day, this is your body. And you should be able to start saying what you want and what you don't want and what makes sense, and understanding what you're taking, what you're not taking. There are a lot of people who I see and they have no idea why they're taking what they're taking. No one's really ever fully explained to them, this is why we're taking this is why this is important, this is what we're going to do, these are the next steps. You want to do that. And like I said, that takes time. The average primary care doctor spends maybe 10 to 15 minutes with the patient and then they have to move on. So that means that you're going to have to make multiple visits to get what you need. So even if you say, oh, well, I just, that one time, no, you probably need to go multiple times to make sure you fully get a clear understanding of what's going on. With us, we are very intentional with what we do and how we do it. We set aside 30 minutes to an hour with each person so that way we can fully understand and ask lots of questions. Did your mom have this? Did your grandmother have this? What are you eating? What time are you eating? When do you feel these symptoms? All of this kind of stuff, because that plays a role in what is going on, helps you to get a greater understanding of what's going on with your body. And then, okay, do I want to take this medicine? How can I take the medicine, but also take this? Or some people say, you know what, I'm gonna take the medicine right now. I'm gonna start putting some other things in place, and then we can see how we can titrate off. Because I keep saying medicine is to protect you. Let's not keep looking at it as this bad thing. Medicine can keep you safe and protect you for that moment. We start getting things in place and we can start seeing how we can start titrating off of some things. But you have to be able to have that relationship with someone that you trust so that you can say, you know what, this is what's going on. This is how I want to approach it. What can we do to help me get there? You want to make sure that they can help you get to your healthcare goals. So, like I said, we do 30 minutes to an hour. So, as you can see, some people get like 4 visits in one visit with us versus like that primary care that's in the traditional system. It's like 15 minutes. That's one visit, 15 minutes. One visit with us can be 30 minutes, which would be like 2 visits, or an hour, which is 4 visits. So you can see just how much we get accomplished in one visit, whereas you may have to do 4 with someone else. So if you're looking to do healthcare differently, you want to be able to create that trust with someone and develop that and say, okay, this is my body and I want to make sure that it is in tip top shape and I want to see what I can do to kind of manage all these things. Then look us up. We are still accepting new patients. We would love to have you. If you are not in the area, if you know someone who is, send them our way and let them know our information. I have my website at the bottom of this so that way you can send them our way. If you're like, I don't know anybody there and I'm not there, listen, we appreciate the support. I'm so glad that you are watching and you are sending the information out to other people, because that's what I want people to know. Because what I'm telling you guys right now is what I tell people day in and day out who come in and we sit down and we have a discussion. And so I know that if they are saying it, a lot of you guys are wondering it too and wondering, like, what can I do to get off this medicine? What can I do to make some changes? Well, now you know. And so I want you to just share it with other people so that they will know. But thank you so much for watching. I appreciate all of the support. And until next time, I am wishing you healing and take care.